Welcome, everyone. Thank you for joining me again today for another Lunch and Learn. And today we're going to be discussing FDA inspection tactics, specifically etiquette, what you should do, how you should act, how you should think. And I hope you find this very interesting and get some helpful hints out of this. Okay, our slide starts here with the basic day one time zero when they arrive. So really the first thing you have to think about is who welcomes the FDA. Maybe an announced visit, you may have time to prepare for it. Maybe a surprise visit where you don't. The really thing you have to think about here, who is typically going to be able to meet the people when they arrive, the inspectors. So are the guards, do you have guards out front? Do you have receptionists? Do you have security? Do you have an entrance type of thing? Really what you want to make sure is that people understand what to do. And this doesn't just apply to those frontline people. This could be something that everyone should be aware of. I can tell you, showing up in a facility and seeing just everyday workers there and to say, hey, I'm from the FDA. I want to come in and inspect your facility. I want to go back here in the back. I want to go use the restroom. I want to get some water. We just want to go over to this room here and sit down and wait for the team to come in. Those are things that have happened where people say, oh, yes, who am I to deny you access? So just confirm everybody knows what to do. Who do you call? Do you call anybody, or is the phone list updated? Are you going to call people that have left from several years ago? Who do you call if somebody doesn't answer their phone? They're on vacation. What do you do in situations like that? Do you have a sign-in process? Those are things that you have to bear in mind and have people think through it. Before taking the inspectors to your room where you're going to host them, have someone go through the conference room to scan it. How many times I've gone into a room and up on the board and the whiteboard has been written all these notes. Very interesting. The flip charts have been in there. Postings of things have been in there. Even a live TV monitor has been in there where people were standing there really watching things going on in a particular area or looking at data. All of those things, if you don't scan even the trash cans to make sure everything is thrown away, you put yourself in risk of someone seeing something that you hope they hadn't. So do yourself a favor, just verify that you're ready from day one, time point zero. One of the simple rules really in this is do not leave the FDA alone. Any point in time, they may want to do something such as go to the water fountain. Typically, it's go to the restroom. They should never be left alone. So ask a colleague to help you so that you can be with the host in the room. Someone should always escort the FDA to wherever they're going. The FDA should never be alone unless they're in a room and they've asked to be left alone. When you do that, escort them to the restroom. Make sure everything is clean. Make sure people aren't standing around in there talking, especially if there's multiple stalls. Sometimes restrooms, believe it or not, can be little mini conference rooms. So people certainly stand in those and talk to other people, talk on the phone. You just want to verify that people around in the area or certainly in the restroom area itself are aware that the inspector is coming there. Wait outside until the FDA inspector exits and escort them back to where the room is located. You don't have to be in the restroom with them. Certainly, I'm not asking that. Please don't send me emails on that. I just really want you to understand that you should escort them wherever they go. Just use common sense with this. All right. People always ask me this question. What do you do if the FDA wants to take samples or pictures? Well, let's start out with the first one. All right. I always suggest to people to have a procedure that says no photography, no video recordings, no audio recordings are allowed on site. But let me tell you this, if the FDA wants to take a picture, they can indeed take a picture. There's just certain levels of defense you can put up. Most inspectors will say, no, that's fine. They won't take a picture. But let me tell you this, if they want to take a picture, there's something that they're seeing. They're wanting to put it into their evidence package. I will give you this piece of advice. If they take a picture, you take a picture as well. Um, just work it out, whatever it is. You have to have a deviation. You have to have something in place to do this. Then you do that. Do not allow them to take a picture and you don't get the same data, the same evidence, the same photography, video, whatever it is. Make sure you indeed get that yourself. Now, if the FDA wants to take a sample of something, that's fine. They typically can do that. If it's something that they can actually carry out with them, that's not temperature controlled via something that they can normally handle, then that's fine. If they want something that's, say, refrigerated, frozen, cryopreserved like that, you will have to work on some type of shipping system to get those samples to the FDA. Refrigerated might be something as simple as you put together a packet with them to take with them, a styrofoam container with a cool pack with it, maybe even frozen, but that's a little more dicey. Really work with the inspector as to what is it that they're wanting and just understand the requirements of your product. Don't give them something that's supposed to be refrigerated and hand it to them and have them hold on to it all day. That is absolutely not something you want to do. All right, this is an interesting one. What do you do if the FDA requests to go through files? Now, you have to think of it two different ways. One, you have paper or physical files. You also have electronic files. There's some guidelines around this, though. The FDA has to be able to request specifically what they are looking for, especially in a paper file or a cabinet, filing cabinet, or someone's desk drawer. What you can't do is just allow them to go through browsing, looking through things. Here's the key to the filing cabinet. Open that drawer up, do whatever you want in there. No, really, the reason why is a couple of things. One, there might be personal information in there, records of personal nature. It could be something that you have reviews in there for someone that's an employee. Also, if you've got a file set up, you've got things in there in a specific order. What you don't want to do is have someone going through, rifling through your files and messing things up. More than happy to give you anything you want, Inspector. Just tell me what it is you want. I'll help you go through and look at whatever it is you're looking for. And electronically, they can say, typically, this is what they do. They would say, show me the audit trail of a particular piece of equipment, or show me where you ran this test. Show me where you logged in. Show me you can't log in if you don't have access rights. Go to your wastebasket in your main computer screen and see what's in there. Those are things that they can indeed ask to do and typically do ask. So the FDA wants to touch things in the lab or manufacturing area. Be particularly careful with this. All right. You control things in those areas. What you don't want are people coming in and just picking up stuff, touching things, doing whatever they want with stuff. Really have to be careful with it. So an inspector should not be able to come in and pick up things. More than happy to help them look at anything. You just want to show that you are in a state of control. That means people can't come in and just pick up stuff, move things, especially in a laboratory area, especially in a sterile manufacturing area. Those become critical items you really want to take control of. So, what do you do if the FDA requests a document that's no longer on site? We all have the same issue. Everybody has it. I can't think of any company currently today keeps all records on site. Typically, they are shipped off site to some type of storage facility. And so I asked for a record from a year and a half ago, some investigation, some validation protocol, something that you've put off site. Don't don't lose your cool on this thing, all right? If the document can't be retrieved on site, make sure you go to whoever it is you sent it to, immediately put in a request. Tell them the FDA is on site and they are asking for this particular document. Typically, you'll have some box number, a location number, some type of code where they know in order to retrieve it. So that'll help the archive facility be able to very quickly locate it and pull that information for you. What you also want to do is ask, when can you get that to me? Don't sit there and assume, oh, I told them the FDA is here and they're going to get it to me as quickly as they can. As quickly as they can means what? Everyone has their own standard. Quickly as you can could be within the hour, could be within the afternoon, could be within the week. You want to make sure that you understand specifically what is it it's going to take to get that document to you in what period of time. And also don't miss the fact that when you get that document, especially in a box with a bunch of other documents, you're going to have to go through that thing and find it. And then you're going to have to QC the document and verify everything's okay with it. So build those times into your calculations. Inform the host in with the FDA that there is a delay in obtaining this thing because it is stored off-site. That's perfectly fine. The FDA sees this constantly. They understand that. Okay, great. They may, you know, give you what for because of it, but it's all show. You just have to say, look, it's stored off-site. I cannot materialize this without it being brought in from off-site. Just be cautious of the timing for this. You know, the FDA is looking for things in a timely manner. So they'll build into their understanding, okay, it's stored off-site. How long does it take to come in? Give them a reasonable time. All right. Build in a little bit of time into it so that you don't say, oh, it'll be here at 2 o'clock today and it shows up at 2:30. Build in some time. It'll be here this afternoon because you have to get it, you have to verify it's there, and then you have to put it in, QC it, take it through the process of getting into the room. Those are things you can absolutely do when the FDA asks for something stored off site. Just make it work for you. All right, some basic information here. What you should do, you should always remain calm. And I know that's easier said than done, especially when the agency shows up, especially when they show you their badge and things start going sideways or south. You want to make sure that you remain calm under pressure. A lot of these things are really designed to throw you off your game, to make you make rash decisions or rash statements. Take a deep breath. If you have to, step out of the room. Just take a deep breath, calm yourself. Look at things that help you become calm. I don't care what it is. Just step back and say, I will be remaining in a state of calm, cool, and collected. Be prepared to answer a question. How do you do what you do? How are you in this role? Really, it comes down to the question of how are you qualified to do your task? by either training, experience, or education. They're really looking for you to answer that question. However, this question is answered or asked, make sure you answer it in such a way that you show that you are competent and capable of doing the task in which you are assigned to do. Use reference items, go back to your SOPs, job aids, work instructions, whatever it is that you have to do to answer the questions. If you stand there and you tell me, hey, I sample X number of units, okay, show me your procedure from that. You pull up a procedure and it's Y number of units. Now you've answered the wrong question. You're always going to have something in your mind, either a previous version, or you're going to mistake something. It is not a problem to go back through and pull up the document to answer the question, especially when it's detailed, technical, specific. Pull up the document and say, here's what we do. Here is the information. Use that to your advantage. Uh, be mindful of the tone that you use with the FDA when you're speaking with them. If you think of me sitting here now using the tone that I have, it's more instructional. It's giving you the facts, the information. I could also be very, very pointed. I could be very loud. I could be leaning into you, using my finger to point at you for things. That's a defensive or aggressive tone. You do not want that. The FDA is mindful of this. When they hit upon something in which you become defensive, their first instinct is there's something going on here that I need to dig in further. So, again, go back to that first point I told you, remain calm. Use your inside voice, as parents would say to their young children. Make sure that you bear this in mind as you're speaking to the agency. Outweight silence. A lot of times, I will ask a question, you'll give me an answer, and I'll leave silence in the room. And it is palpable, it is powerful. People hate the silence. They want to fill that void, that gap. So they'll start talking. It's a very, very commonly used tool. Just mind yourself. Understand if you're asked a question, answer it and be quiet. If there's nothing else asked, just be quiet. If you have to speak on something, I don't care. Speak on the weather, speak on the baseball game, whatever it is. Do not talk further about the subject or the company or the GMPs or the inspection, whatever it is. Refrain from discussing internal issues during the inspection. Don't be sitting here talking about the layoff. Don't be sitting here talking about upcoming personnel reviews. Don't be discussing upcoming supplier audits. All those things, do not be discussing those in front of the agency. Understand that whenever you discuss things, that may open the door for them to ask further questions. And finally, refrain from offering the FDA quote unquote gifts, right? You do not want to give them things that they consider as maybe this is I use the term bribe, all right? Something that is intended to sway their opinion on this. Water, coffee, snacks, yes, that's fine. That's okay. But certainly, I'm not sitting here going to say, oh, well, FDA, if you're not doing anything tonight, we'll take you out to the nicest restaurant in town. That is absolutely not what you should be doing. If the FDA asks you where they should go for something, a particular thing, that's fine. You can give them options, but do not be there offering them anything that they could misconstrue as a bribe. All right. In today's age, I'm always asked about these things. Cell phones. It's great. They're fantastic. We use them all the time. In fact, we don't even, most of the time, get a sense that we have them or are using them. They can be useful tools. They can also be a hindrance to you. They can be a distraction. You can text people in areas to say the FDA is headed to your area. Absolutely, that's great. You can also send out an all-employee text that says, hey, the FDA is on site. Be aware and cognizant of this fact. You want to make sure that you use these things with a bit of caution, because if you're sitting there talking to the FDA, if you're speaking to them and things come up on your phone, what's our typical approach? We pick up the phone and we scan it for the text. That's annoying, especially during an inspection. It's also distracting. It can also throw you off from your thought process. So be aware of this. All right, you can text people around in certain things. It's a tool, it's a great tool. Absolutely, I'm not arguing that. What I'm saying is you have to be aware that if a person is standing there talking to the FDA, they may pick up their phone if someone comes through, and especially a call comes in or texts are just barraging them. Don't do that. If you go into the room with the FDA, I highly advise this. Leave your phone outside. Don't take it in. When you're in the hot seat and you're sitting there with the FDA, the last thing you want to do is start getting texts, phone calls, messages, emails, Teams, chat, stuff, whatever it is that comes up on your phone. Do not be having that, especially if you have the volume up on it and you have some wild ringtone, or if it keeps beeping or it keeps buzzing as it's sitting on the table. Those are distracting and annoying. Do not do that in the room when you're there with the FDA. All right, I put this slide in here because I want you to understand very specifically something that I see constantly. Dealing with the investigator, the inspector, they're sitting there. What we want to do is demonstrate our knowledge of and our confidence in our quality system. Now, there's a fine balance here with my friend over here. You can see balancing on the rope. There's a fine line between confidence and arrogance. You want to say that we are confident our system works. We've got data that shows us that it works. I'm always open to improvement, enhancements, evolution of it. That's critical from that perspective in getting the tone and the sense of your culture to the investigator. You do not want to get a tone of, well, we are X company, we know everything. You're here to inspect us because you don't know what we do. We are the ones that know what we do, and we're the experts. That's rather arrogant. You do not want to come across that way to the FDA. All right, the don'ts during an inspection. Never, ever positively ever give false data. Always tell the truth. Now, let me caveat that by saying if you need to take some time out to come back and say, how do I present this information? That's true and factual, but it may not be well received, maybe a problem. Go back out and say, let me go get the data, let me gather this, let me make sure I'm seeing what I'm seeing. I just want to check on this and confirm it. Whatever it is you have to do, be professional about it, be courteous about it. Don't just blob it out, but take it and use it to your tactical advantage of how do you present information. It is okay to say, I don't know. You can't go in and say, I know everything everywhere all the time. You can say, I don't know, but I will get someone in here who does know. I will get that information for you. Let me check on that. Whatever it is you say, just confirm that you indeed do uh, present the information factually. Don't guess. Don't speculate. Do not come in and say, I think it's 5, but let me check. That is not what you want to do. It is, let me confirm that answer and I'll get back to you. The investigator may ask the same question to different people at different times. That is not them suffering from Alzheimer's. That is not them forgetting. They are confirming that the information being given to them is correct on all levels. Whoever is telling them the answer X, that it's the same answer from multiple people. And certainly, as I said before, use your SOP or other documentation, whatever it is, batch records, work instructions, whatever you happen to have to answer the question, especially if it's something technical. Pull up your procedure, because I can tell you this. If I ask a question and you give me the answer without looking at anything, oh, the answer to your question, Troy, is X. I'm going to say, great. Is that proceduralized? Yes. May I see the procedure? And you bring me the procedure and I say, show me where in here it says X. And now you're scanning through saying, well, yeah, it's not really X. It's a little bit here. It's a little different. Use your own documentation, your own procedures, your own instructions to answer the questions. It's powerful for you to do that. All right, investigators are always aware that interviewees, people sitting in front of them, are going to be nervous. All right, don't be sitting there thinking, oh my, they're going to think I'm lying or doing something wrong, and I'm stressed and I'm fidgety and I'm doing things. That's fine. We understand. It is absolutely expected that you're nervous, and it's not a problem. It's okay not to be nervous as well. It's just we understand that. I can tell you many times asking people questions, and I've watched them be very nervous. That does not disturb me. Understand that firms prepare employees for inspection. Absolutely, the investigators understand that. They understand that there's training. They understand that there's a war room or a prep room. Come on. If you're thinking, oh, the FDA doesn't know that this exists, you're gravely mistaken about that. They know that firms don't want to divulge adverse information. That is fine. That's why they push and pull and tug and spin and twist and ask multiple questions, multiple ways, because they're wanting to understand that. That is fine. They look for it that you are wanting to be protective, but they also look for that given specific requests that you will give them that information regardless of how it looks for the company, and that they are trained, understand this, the FDA is trained to detect deception. I can only stress this: do not lie. Do not deceive them. Do not try to think, oh, I'm leading the inspector down this path, this road where things they'll forget this or they'll miss that. They are they are trained to perceive it and understand it and then drill into it to see if it's real. All I can tell you this is, don't lie ever to the FDA. Do not try to deceive them. Do not try to mislead them. They will detect it. If they detect it and you have been deceiving them, it is checkmate. You are out of luck. I don't care if it's one person, one group, whatever it is, the company now has a very serious problem that you're going to have to deal with. One point I want to make with this slide is very important. It's an old adage from World War II: loose lips sink ships. It was really designed to keep people from talking about shipping timing and convoys and things like that for German submarines who were sitting off the coast that would sink them. So, what I am talking about here is the same concept. coming in, discussing things openly in hallways, even in rooms where you think it's secure, sounds travel. You could have people sitting next door. I've sat in rooms listening to people have discussions coming through the ventilation ducts down through the ceiling that I could hear them discussing things. I could hear people in the back areas discussing things very loudly because of the noise. And you sit there and you hear this stuff. I've even been at restaurants where people have come through, they have no idea who I am, and they're sitting there talking about the site and the issues that are ongoing and how the people there that are looking at things and doing the assessments of their processes have missed these things. And I've sat there taking notes on napkins because people spoke openly. I can just tell you this. If you don't believe it, it will indeed happen. In hallways, you'll be talking, and the FDA will walk around the corner. In the bathrooms, in break rooms, anywhere you go, there'll be all these things going on where it is a potential for the FDA to walk in or hear it. I'm not saying you can't talk about things, but I am saying be very careful with it. Make sure, verify that you're in a secure area, doors shut. You keep your tone down. You are able to discuss things in a manner in which it is indeed controlled. Okay, this one. What would raise a red flag with the FDA? And there's many of them. This is just meant for a quick overview of items, but some of the key specific ones I can go through here with you. Conflicting information. I put that as number one, mainly because it is a high level a number of observations made by the FDA is that people do not follow the procedures that are written for them. It's conflicting information. You do something that doesn't align with what your procedure says. You've got data that says A and data that says B. You've got information that doesn't align. Verify that all the data is in alignment. Number two out of this, data does not align, which is very close to number one, is what I'm talking about. Verify this stuff before you send it into the FDA. Strategy should be very key in understanding what we've already said, what we've already given to the FDA, plus what is it the FDA is looking at. Excessive delays in getting requests. Now, understand you can have issues, one or two here or there, whatever it is, that's fine. What I'm looking at is excessive delays. If I'm asked for a procedure or an investigation and it takes you a day or so to get it to me, why? What is it? What's going on? There's something not right. So verify that you are getting data to people in a timely manner. People performing work that they are not trained to do. It may be that they aren't actually trained to do it, or maybe that the documentation is not there to support that fact. Don't overlook simple things. Laboratories are big items where it goes into this. Sterile operations is a big area where this goes into this. GMP training, Alcoa training. Verify that people have the documentation to prove that they can do the work. Poor aseptic technique is the next one. I cannot tell you this how many times people are trained to do things, and in the heat of stuff getting things done, they exhibit poor technique in an aseptic world. It could be as simple as walking too quickly, doing work too quickly, exposing your head inside an aseptic area, say a BSC or a RAB system, uh, all those types of things, picking things up off the floor and actually using them has been observed by the FDA. Incredible that those things still happen, but they do. And so you need to verify that people are not performing bad aseptic technique. In an aseptic world, this is not only a red flag, it is a freaking burning flag that says you've got a massive issue. Facility in a state of disrepair. How many times you come in and you look and you walk in the outside, I walk in the outside and I see trees little saplings growing out of the gutters where they aren't cleaning the gutters. I walk in and I see stains in the ceiling from water. I was in a conference room and asking the head of quality, do you maintain your facility in a good state of repair? And he went through all these things, the procedures, all the stuff talking about it. And I said, well, that sounds really good. And I'm just curious. We're in the middle of the building and there's a big stain right above your head in the ceiling tiles. How do you explain that with what you just told me? And he couldn't. That's a problem. And lastly, here, disorganized, be it getting information to you in time, getting information that is the correct thing to you at times, and then looking at stuff. Let me say this is like a 5S concept, right? Everything in its place, it's organized, it looks like it's in control. Walking in, and I'm thinking, this is as good as it gets. And I look at it, and it looks like a madhouse. It's disorganized. People are running around. Things aren't where they're supposed to be. Whatever it happens to be, it's totally disorganized. That is an absolute positive red flag. Here's a great one for you to have. This is a great lunch and learn item. What are FDA expectations? It's very simple, and I put it down in these bullet points here. If you get these, I tell you, of all things you're going to get out of today's session, have this list with you and understand that these things should be in place. These are typical FDA expectations. Number one with this, right? Be in a state of control. Simple as that. What do I look for when I walk into a facility? Are you in a state of control? How do you show it? How do you demonstrate it? How do you prove it? How do you document it? Number two with this thing, understand your systems. How many times I've asked people things and it is that they don't even understand their own systems. Right after that, follow your systems. You wrote the procedures, you wrote the policies, you wrote the guidance, you wrote the stuff that's there, and you don't follow it. That's incredible to me to come into people and they say, yeah, we wrote this, but we can't follow this procedure as written. It's not my problem. You need to write things that you can do. Understanding your regulations. What is it that you have to do? What are the things that you need to risk mitigate? Understand the risk that you have in place and control it. I'm not saying you have to do everything everywhere, but you should at least understand some of the high level items. When you make an error, can you find it? How do you find it? What do you do with it? How do you escalate it? Correcting it, controlling it, learning from it, mitigating the problem. Be truthful. I can tell you this, whatever it is that people come to me is they try to tell me stories. They give me all this nice fluff and stuff. It's not truthful. I'm looking for people to be honest. I'm not asking you to throw out all your dirty laundry. I am asking that you be forthright with the data that you have. And if you've made a problem, own it. Own it. Don't hide it. Don't skirt around it. Don't give me this bullshit story. Tell me what it is that happened. And I can tell you, it's always interesting to me when people think they can go around the FDA and not be truthful. Right? Be patient. Be slow, deliberate, especially when the inspector is writing down the notes of what you're telling them. If there's ever anything you learn from this, you're nervous, you're stressed, you have this great thing that you're saying, and you tell the inspector, and you're done with it, and he says, wait, can you go back and repeat that? And what happens? You sit there and think, I can't do that. I have to rethink what did I say? It's like it's erased from your mind. Be very deliberate. If you see them writing things down, take your time, pause, stop, let them be able to take notes soak it in, and understand it. Provide all the documentation that's requested. I can say that people ask for documentation and it takes forever. You give them the wrong documentation, you give the wrong things back. Prepare this stuff ahead of time. If they're asked for copies, make sure you give them a copy of it. If they get a copy, you get a copy. One word of advice with this: if the FDA gets a copy of something, you stamp it confidential. Verify that you put that on there. Otherwise, it's potentially open for an FOIA request, a Freedom of Information. I can put that in for all documents associated with it. If the FDA messes up, I can get a copy of your procedure, your investigation, your report, whatever it happens to be. Excuse me with that. Be timely with getting data. That's a big expectation. Not that you give everything right away, but you have reasonable, logical times for getting stuff to people. Have the right people speaking on the right topic. How many times been inside a room, people come in, the FDA asks a question, and the person says, "Oh, that's not my area, that's someone else's." You could do that once, maybe twice, but after a while, it's going to be, okay, what are you doing? Are you trying to delay this, throw this off, just burn my time? And eventually get to the point where it is, give me the right people. Are these the right people coming in to speak to this? Because they're going to start getting annoyed. People are trained to do their tasks. That is a simple expectation from the FDA. What is it that you do, and are you trained for it? How do you know you're trained for it? How do your supervisor, that last point there, that they know that you're trained for it? How do they assign you the task to do a test, to do an operation? Do they understand that you are qualified, you're gown qualified, you're been part of an aseptic process simulation, that you've got the method, you're trained and qualified to do that method? Whatever it is, these are the things the FDA look for. Get these down. Again, if you can have these points down, you're going to go a long way to ensure yourself some level of success. All right, my last slide in today's session, my takeaway list. Number one, always be professional. I know it can get exasperating. I know sometimes inspectors come in and they are sometimes not the best. Some of them are pushing you, really pushing that knife in you and twisting it for pain. Just be professional. Treat the inspectors with courtesy, all right, and respect. They are there doing a task. Don't miss that point. Always do your best to remain calm. I can tell you this: whatever it is you do to make yourself calm, make yourself calm. All right? Everything you say and everything you do reflects on your company. If you say something incorrectly, if you snap at someone, you cannot unring that bell. What's done is done. Now you're in a state of damage control. Number two, know your role. Whatever it is, do your task during the inspection. If you're a scribe, take notes. Don't be acting as a person that's going to be talking to a subject. Don't sit there and say, oh, wait, I don't think that's right. Do not, you take the notes. The SME, you're an expert in something that you're being called in to talk about. Understand the answers and questions that may come up with that thing. It's okay to go back and say, let me confirm that before I give you the response. Just understand that you are the SME and what you say is reflected heavily in the inspection. If you're the escort them around. No discussion of certain things. If you're an escort that you can speak to things, that's fine. Just understand your level of being able to interact with the inspectors. If you're on the tour, if you're there just doing things, whatever it is, understand your role with the inspection. And lastly, Choreograph the process. I cannot stress that enough. It is keenly important for you to bring in someone to pressure test, do a mock inspection of the process, confirm people are ready. I can tell you, this is the difference between education and experience. You can teach people, you can train them in classes, you can go through these tours, these mock inspections, and just give feedback. But until you're there and someone comes in that you don't know and they're going to throw curveballs at you, you have no idea the level of panic that can come into people, and it throws them off. And it is contagious. One person becoming panicked will start two or three, and it's a domino effect. It will go throughout the organization. Something's wrong. Those are the things that you better off find out before the inspection than during the inspection. Test all of your systems. You will thank me for this later. And with that, I thank you for attending another session with me. I very much appreciate people that give me emails, asking questions, giving me feedback. I'm always looking for feedback. Please reach out to me and let me know what you think, what I could do better, questions that you have. I get lots and lots of questions asking for depth and clarity of what I mean, and that is fine. This is what this is for, to have you start thinking about it. So reach out to me. I give you my email account here. Reach out to the company. There's the website if you have any general requests. I absolutely am here to help. I've said it many, many times before. I am here to bring value to you. So if you have a question, please reach out. And again, thank you for your time, and I hope everything goes great for you during your inspection. Thank you.